All right, so this is your first cupping, and we're just going to stay in the thoracic area right now. Anyway, it's stationary. So the movement, right? Stationary versus movement. We can dialogue back and forth on this if you want. The stationary one seems to bring up local circulation, and moving and sliding the cups around does the equivalent of like a deep tissue massage. It's kind of like tilling the earth. It breaks up adhesions. That's why you do the movement. Are you feeling comfortable?
Yes.
Okay. I'm going to go a little bit higher over here. And then just don't hold your breath.
Okay.
As it raises your stress response. And actually, this will get easier over time. The first time you've been cupped, usually it takes anywhere from 2 to 4 times to bring out most of the injury. How are you feeling?
I'm feeling good, and somewhere in my spine, I'm not sure where, I have arthritis.
Okay, how's it feeling with that? Or are you just aware of it?
Well, it just feels extremely tight, and I'm thinking that I may have arthritis in the thoracic spine. That's what I'm thinking.
And that's why you're getting the... you do have some twisting on your spine anyway.
Yes.
So...
Yeah.
And that seems to go the entire length, so that makes sense.
Yeah.
So, the darker purple areas versus the red. The red is normal capillary breakage,
Okay.
like a hickey.
Yeah.
And then the darker purple is going to be the areas where you've had, what are, internal bruises or injury.
Gotcha.
How are you feeling? Still okay?
Yes. The one on the left is the most uncomfortable.
Over here?
Yeah. The two on the right, the one on the top now is becoming uncomfortable. Does that mean that things are drying out?
Right, it's pulling it out. In fact, I can see more on the top area than I can on the other ones right now.
Okay.
So we're just going to stay in an isolated area for sure.
Okay.
Just to kind of minimize how much you have to experience on a first cupping. It's being as much fun as it is.
That's painful. Super painful on the left.
Is that where you were, and this is opposite the area where you were talking about where you felt like there's a round muscle maybe pulled?
It's the right scapula where I'm having lots of issues.
This high?
No, it's
into the
more
scapula
towards,
or down below in the
no,
insertion?
but hang on, it's closer to the spine.
Mm-hmm.
Right there. Right there.
So here,
Yes.
okay, so if you feel this side is actually clear,
Okay.
but if I run my hand along the opposite side, there's a bit of a
Oh yeah.
pull right there. So
yes.
it probably is originating from the left side and then
Okay.
affecting your right. We always
I see.
compensate, and I know body workers will usually tell you that when they give you a massage where they can feel the imbalances.
Okay.
And there, so there's a pull with the darker purples.
Yeah.
Very cool.
This is pretty painful.
It is, but you're not screaming or anything.
I'm not screaming.
That just indicates a good high pain threshold, right?
I have a high pain threshold. Yes, I do.
It's really interesting that the more trauma we experience, whether it's emotional or physical, how that's why they can't do pain scales on evaluation to find out where you're at when you go in for a check-in and really have a good standard.
Yeah.
Because you adapt. You have to adapt because your body's under constant barrage.
Exactly. Yeah. Yeah.
Oh, that's great. That's what you felt. Talking about, so really deep stuff in there. And
Yes.
that one, typically when I see that come up on a first time,
Yeah.
it's just an initial. These could be on tighter, but I'm not doing that on to you. But if
Okay.
it were, it'd pull up even more. But if on a second cupping, you would get a lot more freedom
Okay.
of movement down your spine.
Okay, cool.
Fun.
Fun. Oh, that is so much fun.
It's something to remember, that's for sure.
Oh, you got that right. it came to me this year. Oy, I'm just tired of living in pain.
Good.
You know?
Good.
Isn't that good?
It's good to have a limit. Yes.
I took 20 years of it and no more.
You know, there's a pattern where people wait, where they actually think it's going to go away, and then you don't realize that you could be waiting like that, like you're saying, 20 years, and you're like, no, it should resolve, and then it doesn't.
And it does. That's exactly right. I think that's what I was doing.
Yeah.
Like if I just do enough yoga, it will all magically go away, but no.
Yeah, our bodies got to excavate the things sitting in there sometimes. Well, good, then we'll leave this here, and then
Sure.
I'm gonna stop at this point on recording.
Okay.
And then we'll just carry on.